I am Dr. Rati Devi, Medical Officer from RVS Homeopathy Medical College and Hospital. I welcome everyone on behalf of our Honorable Chairman, Vijay Shri Dr. K.V. Kupusamy Ayya, RVS Group of Institutions, and Shekhar Algunki Sir, founder of SWARA Homeo Gurukul. And I thank to Dr. Kribashni for being constant touch with us and make this webinar possible. And I also thank our respected principal, Dr. Ilaiyaraaja Sir, Vice Principal, Dr. Prasanna Devi Madam, and Assistant Medical Superintendent, Dr. Samaran Sir. SWARA Homeo Gurukul. The dream and voice of one man, Dr. Shekhar Algunki, had humble beginning, a handful of eager learners and an enthusiastic teacher, imparting in a village under a tree. The concept remains, but the number of participants has grown into a huge family with members from all over the country. Sit amidst pictures surroundings in Hatti village in Sankameshwara Taluka of Ratnagiri district in Kongan. The Gurukul hosts 4 workshops in a year in March, May, September, and December. The science and art of homeopathy and its best is taught here in an eco-friendly manner and traditional environment. The Gurukul's workings are steeped in tradition, perceiving the values of being eco-friendly and inclusive. Nature walks, yoga, meditation, and simple but wholesome food served in a traditional patravali. The day begins at dawn, filled with enriching learning and other stimulating activities, and ends in the evening with relaxing interactions, drawing the participants together into a close-knit unit. Now, I like to introduce our today's speaker, Dr. Shriram Hirlekar sir. He is an associate professor and HOD of Organon of Medicine at KES Datta Patel Homeopathy Medical College and Hospital, Vengurla. He is having 18 years of teaching experience and also working as a consulting homeopath at Sri Vignuharta Homeo Clinic. He completed his Gurukul teacher training course at SWARA Homeo Gurukul. Now I handed this session to Dr. Shriram Hirlekar sir. Welcome sir. Thank you sir.
Good evening to all of you, and thank you Rati ma'am for nice introduction. First of all, pranam to our Guru Varya Shekhar sir, and I would like to take this opportunity to thank Honorable Chairman of the RVS Medical College, of course Dr. Principal Ilaiyaraaja sir, Vice Principal, and your teaching staff who have given this opportunity for your students to learn the new things. Because I am also teacher, so we learn Organon, we teach Organon, and students learn it in college. Different things about homeopathy, but those are in books. And what I feel personally is students should be oriented what is happening homeopathy right now in the world. And it is growing fast. There are so many investigations, inventions, and researches are going on. And students should be introduced to such activities at student level. And that's why I will congratulate and I will say thank you very much on behalf of all students that you have initiated this nice workshop, this lecture series. And this is first lecture out of 12. So I hope that students will get lot of benefits from these lectures with different subjects. Yeah, so our today's topic is importance of Organon in clinical practice. Many of us will find that Organon is little boring subject. If you find books of Organon, there are no pictures at all, just like anatomy or physiology. Now these books are there in colored pictures. So usually students find it boring, and as it is boring, it is neglected much. and then people find it difficult to practice homeopathy. So I will request all of you who are listening this lecture that Organon is not at all boring. Only thing is you have to look with a little different angle, and then it will be easy tool for you to use in clinical practice, and your practice will be increased and developed in many folds. Yeah, there are total 6 editions of Organon, as you know. And this 6th edition, which is the latest one, has 2 parts. Aphorism 1 to 70, there is theoretical part, where all the principles are discussed, rules and regulations are discussed. And from 71 to 291, it is called practical part of the Organon, where practically what we do, what we can do, that is discussed in these aphorisms. If we just go on reading aphorism, it feels boring. But if you try to understand the meaning of each aphorism in particular, you will find there is a lot of things are hidden, which can be learned, which can be imbibed, and it will enhance our practice. And some of them we are going to learn today. I'm not going to teach you aphorism by aphorism. It will be a big topic, and it is already we have learned. I want to show you some part of it, what is useful in clinical practice. So as you know, in aphorism number 3, Dr. Hahnemann has stated that if a physician clearly perceives what is to be cured in disease, that means the knowledge of disease. So in aphorism number 1, aphorism number 11, he has described concept of disease. You can read this aphorism. When a person falls ill, it is only the spiritual, self-acting, that is automatic, vital force, everywhere present in his organism, that is primarily deranged by dynamic influence. So there is a footnote even for this, that the influence is dynamic. It is not at all material. So we are not supposed to think of any material thing when we have to understand the concept of disease. Nowadays, if you see in modern medicine, that is allopathy, the concept of germ theory is big concept. But actually those germs, it may be bacteria, it may be virus, or it may be fungi. They have their own vital force. And so they are not dynamic, even though they are microscopic. And this difference we have to understand very basically. So this vital force get affected by the morbific agent which is inimical to life. It is only the vital force deranged to such an abnormal state that can furnish the organism with its disagreeable sensations. Now see, Dr. Hahnemann has clearly mentioned over here, the first thing that happens with the human body is presence of, or the occurrence of, disagreeable sensation which is not pleasant. It can be anything. For example, any kind of pain which is not good, but it is produced because of dynamic influence of the morbific agent. And when such sensations are produced, people go to the doctor. If it is non-homeopathic doctor, many a times you will find that all the lab investigation reports are normal, and so they declare it that you don't have any disease as such. But patient complains that I am suffering. So there is a problem. Then patient goes to another doctor, and this cycle goes on. It's a vicious cycle. The problem is here that Hahnemann understood is disease to be understood at this level and to be treated, then without development of pathology, disease can be cured. But suppose if patient doesn't get right medicine, then what happens? It inclines it to the irregular processes which we call disease. Even now also we call disease to the pathology. Pathology is actually the outcome of the disease, the end result of the disease. According to Dr. Kent, it is called manifestation of the disease. But this is not a disease properly, or this is not the thing actually to be removed. What we do, if suppose there is a tumor, we try to cut the tumor by surgery. But removing the tumor will not remove the disease, because disease is dynamic. So we have to first understand that at what level we should intervene. Because Hahnemann further mentions, for as a power invisible in itself, there is one invisible power which is inimical to our life. He labeled it as morbific agent, and that is causing this pathology. So removing different pathologies is not our aim. Our aim is to remove that power. And only cognizable by its effect on the organism. You may say in this universe there are thousands of different inimical energies. We cannot understand them, we cannot recognize them unless and until we suffer, or our fellow human beings suffer. Its morbid derangement only make itself known by the manifestation of disease in the sensation and functions of those parts. So disease manifestation are expressed initially in the form of sensation and afterwards in the functions of body organs, and then they turn the structures of the body into abnormal type. So at what level we are interfering by giving right medicine, that will decide the outcome of the treatment. If the organs are affected and deranged beyond recovery, then it will be called as incurable disease, because the pathology has become irreversible, and then we cannot cure the disease. But if the disease is at the level of sensation or at the level of abnormal function, or there is a pathology which is reversible, we can cure the disease completely. And that's why this concept of disease is to be understood perfectly, and then we can treat the disease. And we can decide which disease is curable and which is not curable. Then I would like to take you to aphorism 36 to 40, where Dr. Hahnemann has described about 3 possibilities of dissimilar diseases. In first possibility, old disease repels the new disease. Now you can see this. Even in last COVID, there were many people affected with COVID. But there are even few number of people who were already suffering from gross pathologies or diseases, chronic diseases like diabetes, hypertension. They were not affected by COVID. Now why it is so? If you see this first possibility, you can easily understand. The old disease is stronger, then new disease cannot affect that person. If you see the second possibility, new disease suspends the old disease. We find even though some people were suffering from chronic diseases, still they are affected with COVID. Again, the answer is here. If they are suffering from weaker disease and COVID proves stronger for them, they will be definitely affected. And the third possibility is about long treatment with allopathic medicines for chronic diseases, there are chances that they may form complex disease. It is a combination of their natural disease with whatever drug they are taking for very long time may induce the disease. So drug induced disease plus this natural disease will form a complex disease because they are dissimilar to each other. And when they are similar, then stronger one will repel the weaker according to the nature. So this also we can understand in our clinical practice if we understand these three possibilities. As we are arranging this lecture for budding homeopaths, I want to indicate you or take you to this aphorism, aphorism number 51, because many of the students, even they ask me in my college also, what is the scope after BHMS, after MD? I will tell you, Dr. Hahnemann has given the answer even in the 6th edition. He has said, mentioned, how many thousands more of homeopathic morphic agents has not man at his disposal for the relief of his suffering fellow creatures in the medicinal substances universally throughout creation. It means the God has created so many medicinal substances around us in the nature. Only thing is we have to understand their clinical properties, medicinal properties. I want to tell you that in your syllabus for UG, there may be 300 to 350 or 400 something drugs are there for studying. But if you see in present scenario, there are more than 6,000 homeopathic remedies are used throughout the world. See, there is a huge collection of drugs available which are present in different parts of the world. Some drugs are useful in those localities where such plants or minerals are available more. So you have good scope. You can do research on the Indian herbs, Indian plants, and you can become scientist. It is one of the good opportunity. Because some people say that we will practice only those drugs which are approved by Hahnemann, and they practice with 99 drugs only. I would like to request all these new students who are going to become homeopath and about to practice, don't limit yourself. We have to find out exact simillimum for the case in front of us. And that is possible if we do not restrict our vision to only few drugs. And so Hahnemann has given this in this aphorism. He says that in them he has producers of disease of all possible varieties of action, for all innumerable, for all conceivable and inconceivable natural diseases, to which they can render homeopathic aid. So what else we want? The diseases which were not known at the time of Hahnemann, but nowadays we are known to them. For those diseases also, drugs are available. Only need is you should find them out, prove them, and use them for our humanity to give them relief. Then come to aphorism 33 to 36. It's about primary action and secondary action. When I go to take examinations, Viva, I find confusion among many students' mind about this secondary action, secondary counteraction, secondary curative action. See, the difference between homeopathy and other systems of medicine is their medicines act by primary action, means it may be acting secondarily, it must be acting, but they do not pay attention to it. What we pay attention to, the secondary action, because secondary action is the reaction of vital force. So if you give some medicine to the patient by primary action, it will cause some effect, and the exactly opposite reaction will be given by the vital force, which will remain permanent. And so when we say homeopathy gives permanent cure, that permanent cure is possible because of reaction of vital force. And when Hahnemann understood that vital force reacts in opposite way to everything, because Dr. Hahnemann was MD in the system which was prevalent at that time. And in that system, there were many medicines used on the basis of antipathic principle. So if antipathic principle is not giving relief or giving only temporary relief, but afterwards there will be suppression, then Hahnemann thought, why not we should be use the opposite of it. And when he understood the principle of similia, it is exactly opposite of antipathy. And then he got very good results, and so this system is developed. And now I tell you, in so many countries of the world, homeopathy is being practiced successfully, and people are accepting it only because one thing that it is, as compared to other systems of medicine, it is cost effective. And the second important thing is it has no side effects depending upon how you select the remedy. If you select the right simillimum, definitely there will be no side effect. In aphorism 72 to 82, we have disease classification to understand. Before this classification, there were different ways of classifying diseases in different books of medicine. And everybody had different opinion, different angles of viewing at the disease. But Hahnemann gave a roadmap how exactly diseases should be classified. And the first thing he gave bifurcation is dynamic and adynamic disease. If you understand this difference, dynamic means when vital force is affected dynamically by some morbific agent, it will be called as dynamic disease. And when vital force is not dynamically affected, but there are some material things which are affecting us, and then the diseases develop. It may be chemical poisoning, it may be physical injury. So these will come under surgical cases. So if you are able to differentiate which is the disease the patient in front of us is having, then we can accordingly plan the way of treatment. And so Dr. Hahnemann has given the concept of miasms. If there are dynamic diseases, the fundamental causes of such diseases are miasms. But one thing I want to tell you, that Hahnemann never mentioned that there are only 3 miasms. He never numbered them. There are 2 types of miasm Hahnemann discussed about in chronic diseases, are venereal, which are psychosis and syphilis, which develop after some venereal disease. like psychosis after gonorrhea and syphilis after syphilis itself. And after that, he was searching for almost 12 years that what can be the root cause of different pathologies, diseases. And then he could understand that SWARA is the cause of all these things. And it has no correlation with venereal disease. So he called it as non-venereal miasm. But if you go through this edition, 6th edition of Organon, you will find in some aphorisms he has mentioned about acute miasms in case of acute diseases. Again, he has used acute recurring miasms and acute non-recurring or fixed miasms. So he never limited that how many miasms are there. So you also don't limit yourself. Don't always try to classify everything in 3 miasms. Try to find out what exactly basic problem is. And just like in Aphorism 51, Dr. Hahnemann has clearly mentioned that you have a scope to find out new remedies with proving. Here, you also have an opportunity to find out even new miasms. Few years back, some homeopaths are saying that cancer is a different miasm. Some people saying AIDS is a different miasm. We have to study this. Even Allen has given tubercular miasm. He called it as pseudo-SWARA. It looks like SWARA, but it's a combination in such a way that it's a little different. So it's a tubercular. So this homeopathy is not limited only in book, that you have to by heart it and you have to reproduce it. There is a lot of scope for you to do research in these areas. So these miasms are the fundamental causes of diseases. If there would be no SWARA, there would be no disease to the whole human race. This is what Dr. Kent said. Because it's a starting point of abnormality. And now it has inherited. So you will find almost every person is minimum psoric. But the condition is, if this SWARA is in dormant state, latent state, then you will not have any symptom. And you will look like a healthy person. But when you get exposed to some triggering factor, Hahnemann call it as exciting cause or causa occasionalis in case of acute disease, then this SWARA get activated and you develop symptoms of the disease. So we have to understand the cause of disease, the etiology of the disease, so that we can plan the treatment. So concept of miasm is very, very important to understand in case of selecting the simillimum. Now come to the aphorism number 83, which is my favorite aphorism, because from 83 onward up to 104, we learn case taking. And I tell you, my friends, this is our bread and butter. If we don't take the case, we cannot understand what medicine is to be given. So in this aphorism, Dr. Hahnemann has given the definition of case taking. It is individualizing examination of a case of disease. See, individualization is important. Only examination has no value. You have to examine the patient in such a way that you are able to understand what is unique in this patient that is abnormal. You may say it has PQRS symptom. What is strange? What is peculiar? That we have to find out. And that kind of examination will be case taking. Otherwise, just mechanically going to the patient, asking the data and filling the form, that is just mechanical work. Anybody can do that. There is no need of any skill. But if you have to become a successful homeopathic physician, you should have these 4 qualities. Then only you can become successful prescribed. And the first quality Hanuman mentioned is unprejudiced mind. See, everybody is prejudiced nowadays because we think too much, because we are intelligent. And here I remind my teacher, when we used to ask question. In one seminar, Shankaran sir told us, how much should be the IQ of a homeopath? It should be below 100. We were surprised. Why? Because doctor should be intelligent, na? He said, during case taking, not always. During case taking, if your mind is running fast, you cannot become unprejudiced. So stop thinking at the time of taking the case. Be empty and just like a blank slate, so that new things you can write. And then you can understand the person sitting next to you. So this unprejudicedness is very, very important. But how to get rid of prejudices? It is so simple thing. Whenever any thought comes to your mind, just say to yourself, I know, but. Means suppose a patient in front of you is telling some symptom and you will find it is a keynote symptom that you have read in some remedy in Matramedica book. Tell yourself, yes, I know this is one of the symptoms of XYZ, natramure, for example. But if this patient is belong to natramure, he will give me more characteristic symptoms of natramure. Then only it is true. Otherwise, you cannot prescribe on the basis of one single symptom. So if it is natramure, case will go in that way. So just listen to the case. Don't stop there. So say to yourself, I know, but I want to listen more. And easily you will get rid of these prejudices. The second quality is sound senses. You should observe the patient right while entering your cabin. The way he enters, whether he asks, may I come in, sir, or ma'am, or whatever, or he suddenly rushes in, how he sits or she sits in the chair, how he talks, so many things. If there is any smell coming from that patient's. So all our special senses be alert. And when these senses are alert, you can note down so many things about patient even before patient starts talking about his problem. And if we train our brain in this way, case taking becomes easier and homeopathic practice becomes like dust of your left hand. You can do it anything. Anybody can do. The third quality is attention in observing. With your senses, you can observe with your eyes. But when you are observing, you should be attentive. Otherwise, you will be just seeing with your eyes. But if you cannot understand its meaning, then it's wrong. So again, I will take you to aphorism number 3, the very first line. If physician clearly perceives, and Dr. Kent has given too much stress on this word perceive in lecture number 3. Why? Only seeing is not important. Anyone could have used this word seeing. No, perceive, seeing with understanding. That perception you have done rightly, then only you will find the symptoms are correct. And once you collect such symptoms, then you can use your Metramedica, use your repertory, anything, any tool you can use, and you can find the right remedy for your patient. So attention is very, very important. Whatever you are observing, is it right or wrong? And if it is confusing, just wait. And still you are not getting any answer, then ask question about it to the patient. Patient will give you everything and then make your mark. Otherwise, whatever important symptom is in front of you, but if we are not attentive, it will get missed. The last quality that Dr. Hahnemann mentioned is fidelity in tracing the disease picture. We know fidelity. Fidelity simply means faith. Faith with confidence, you can say. You should have confidence about tracing the disease picture. How this confidence will come? Here I remember a dialogue from a Hindi Bollywood movie, Damini. Do you know about Sunny Deol? We got award for that. And the dialogue is, when someone shows him some weapon, he says, ऐसे हथियार बाजार में बहुत मिलते हैं, लेकिन इन हथियारों को चलाने के लिए जो जिगर चाहिए ना, वो दुनिया के किसी भी बाजार में नहीं मिलता. He meant you can get any weapon in market, but the confidence, the skill that you should have to use that weapon, that you will not get in any market. You have to inculcate it. You have to develop it within yourself. And that's why I have put this. You are what you believe yourself to be. If you believe in yourself that you have to become a homeopath, you will. No one can stop you. But if you have doubt, you can't. Similarly, in tracing the picture of disease, you should have faith in yourself that if I follow all the methods taught by our teachers, I will definitely reach to the remedy. I will definitely collect the whole totality. If this confidence is there, definitely you will be successful. And how this confidence will come from? Definitely it will come from practice. I always tell my students, see 500 cases anywhere in clinic, and then bet me, if you can't become homeopath, I will give you whatever you. If you see 500 successful cases, you will develop huge confidence that any kind of case you can receive. It may be difficult case, rare pathological order, disorder case, acute case, chronic case, whatever kind of different kinds of cases you will see, because there are so many homeopaths practicing all over India and all over world who have many successful cases. You can follow any method, it doesn't matter. The final outcome should be the simillimum. I can tell you, if you have to reach any destination, you may go by walk, Some people may go by two-wheeler, some people may go by four-wheeler. It doesn't matter which medium you use. If you are reaching the right destination, that method is correct. So fidelity is more important. And if you are not confident about yourself, patient will never stay with you. Because whatever prescription you will have, your confidence will be shown in your body language. If your body language is confident, patient will also get impressed. Whatever conversation between you and your patient will decide whether patient will come to you for follow-up or not. If you find the patient doesn't come next time, find out what is the problem. The problem must be, first thing, that your conversation, the rapport between you and your patient hasn't developed properly. Then the next thing comes about result of the remedy. But if your rapport with patient is good, even though patient doesn't have got relief, patient will come to you and will tell you, doc, please give me another medicine. Whatever medicine you gave last time has not worked. So patient will start believing in you, not in medicine. So he or she will come to you again. So here onward, Dr. Hahnemann said, the first point of business is case taking. How to take the case. It's a skill. So many authors have written, homeopathy is art and science. So in first 70 aphorisms, we learn about the science. We learn about the principles. We learn about what homeopathy is. But now how to put it into practice? These are the practical part aphorisms. So simply there are 3 steps in taking the case. In step 1, that is explained in aphorism number 84, when patient narrates something voluntarily, do not interrupt the patient. Do not disturb the patient. This is the first step where patient is narrating something. When I started attending this SWARA Gurukul, I got tremendous change in my practice and case-taking skill. Initially, I used to take case. There were some results. But after learning case-taking skills and guided case-taking from Shekhar sir personally, the lot of things change. And I tell you nowadays, many a times, when patients enter into my cabin, I do not ask even name of the patient. Because sometimes patient, even before sitting into the chair, start telling about complaint. And if you start asking, please sit and tell me your name first, and then what occupation and what address and mobile number and all, it's all gone. This is mechanical case taking. And your level is not matching with the patient. You are talking at the fact level, patient is in problem. So you should be aligned with the level of the patient. If patient is trying to tell you something, your duty is first to listen. Let him get empty. And then you can do. So sometimes at the end of case, I ask them, what's your name? Or phone number or whatever details. Because these things, you can ask the patient and take at any time. That patient will never forget. But the things that in his mind, what he is ready to tell you, if he forgets, the same thing may not come again in his mind. and you may miss very important symptoms. And that's why Hanuman has given this first instruction not to disturb the patient. And he has clearly mentioned, if anything patient is telling or patient's relatives are telling, physician sees, hears, and then remarks. And this is especially in case of relatives. When relatives make any statement about patient, this patient is very angry. Don't easily write down anger easily. First listen to them. Confirm it with the patient. Ask them what makes him angry, how he reacts when angry. Ask the same question to the patient, get confirmation, and then make your symptom. Otherwise, there will be many differences, because relatives also, then whatever they narrate, that can be their perception. It may not be 100% true. And what we want is 100% reliable totality. So that once you make the totality, anybody can prescribe on them, not only you. And that is the situation we have to bring. Otherwise, one patient given to 10 people or one patient case, 10 people listening, they will come across 10 different remedies. This is not scientific homeopathy. What we want is scientific prescription. It will come only you follow the rules of case study. If you make the true conceivable totality, conceivable portrait of the disease, and that will come when you patiently follow the rules and get only true symptoms from the patients and their relatives. So this is very, very important aphorism. I will recommend you, even though you are student or practitioner, please go through this aphorism once again and find out if you have done any mistake. You will never do it again. Because once you understand this is your mistake, you will rectify it. So whatever patient's inside story is there, it should be understood first. It should be allowed to narrate first. And then you can ask other questions. So this is first step where voluntary narration of the patient we are listening to. We are listening and we are writing. So ask the patient to speak slowly. This is what Hanuman has told at that time. Nowadays we have smartphone, computer. I will recommend you that you can record at least audio. If you have missed any symptom, you can listen the audio and you can correct the symptom. That is also possible nowadays. Second step is complete the symptoms by taking particular details of each complaint. Here, in first part, patient has given some symptoms, but those symptoms are not complete in order to understand them in relation to their location or sensation or duration, extension, whatever. Here you will find Bonningson's concept of complete symptom, which is simplified by Boger into 4 parts: location, sensation, modality, and concomitant. So in some cases, patient might have given location and sensation, but no modality. Sensation and modality, but not exact location. So all these things you have to ask to the patient and complete them. And that's why Hanuman has given instruction that every symptom should be started on fresh line, so that there should be gap between 2 symptoms. So whatever data patient will tell after you are questioning can be filled under respective symptom, and that symptom will look like a complete symptom. And then in third step, we have to ask more details, because patients are not known, not familiar to homeopathic way of case taking. So they know many things, but they might not have mentioned. So we have to ask such special questions in order to get the disease picture clear for us. For example, we want to know more about their nature, what kind of personality that patient is. That we should ask, and then only patient will tell. Even sometimes, even after telling, asking also, patient do not tell. If you ask, tell me about your nature, patient will say, how can I tell you about my nature? You can ask to my husband, or to my wife, or to my friend. So at this point, you have to be alert for such type of replies, and you should answer them. It's okay, but right now I want to know from your mouth. I will ask to them even, but right now, whatever you can, just try, and then patient will tell. In this aphorism 89, there is idea of fiend disease. Fiend disease means some patients are cheater. All those who are students, definitely we all were students in some or the other time. You might have done this trick. Suppose you have your school, and you are some distant cousin have come to visit your place. And when you attend school, suddenly you tell your teacher, the teacher, there is pain in my abdomen. Can I go home? Of course, teacher is not doctor. So he or she will tell you, okay, go home. And once you come out of the class, there is no pain. Actually, there is no disease, but you cheat them. That is called fiend disease. So when patient tells something, physician should be alert whether whatever patient is telling is right, correct, or there is some information mismatching. So if you ask some tricky questions, then only you will come to know. And once you understand whether it is a fiend disease, then if you just prescribe placebo, then everything will be all right. Because actually there is no disease. And whatever symptoms they tell, these are just their imaginations or story made by them. What kind of patients we get? Dr. Hahnemann has given very fine description about it. We get indolent patient. They are very lazy. If you ask them, what's your problem? They will say, doc, I got fever. Okay, tell me about fever. Fever since 2 days, doc. Okay, at what times? Today I got in the morning, doc. And when it was on yesterday? Yesterday also it was in the morning. So what was the condition when you had fever? I was just lying in bed, doc. See, what kind of questioning is going on? They are answering only one-liner. It doesn't mean they are not intelligent. But what exactly the condition is? Most of the time, this is the type of their constitution. So you have to deal properly with this kind of patient. And exactly opposite are the other kind of patient. They are hypochondriac. They will express their disease picture in such a manner that you will get really surprised. They will tell you, doc, I got fever yesterday morning. It was, I think, 1010. Because today also I have fever, and when I check in thermometer, it is 102. Yesterday it was even more. So what kind of thing this is? This is something which is exaggeration. And when we find such kind of persons as a patient, we should be very alert about information they are providing. If we take them at face meaning, we may fail. So we have to cross-check such information. Why such people do like this? Because they feel if they describe their problem in vivid manner, doctor will pay more attention and will give them such a strong remedy which will cure them fast. Third type of patients are patient coming after taking another treatment. And this type of patient you will find every now and then. So when such kind of patients come to you, there will be two types of diseases, acute and chronic. And I tell you, some people remember only the treatment advised by Hahnemann, the way treatment advised by Hahnemann only for chronic disease they remember. For chronic diseases, Hahnemann suggested that patient has taken medicines for long time. So the disease picture and the drug picture will get mixed, and you may not able to find the true natural disease picture. In such cases, you can give placebo for some days, ask to stop the previous medicine, and come after certain time. Meanwhile, symptoms of the drug disease which was taken by patient will disappear, and whatever will remain will be the true natural disease. Now, if you do this trick in case of acute disease, you will fail. Because in acute disease, patient needs fast relief. And if you give placebo for 15 days, patient will go to another doctor. So remember, in this condition, you have to take the totality. It is a mixed picture of true natural disease along with drug disease. But you have to prescribe for collective totality. That is the way to treat with acute condition. Fourth type of cases are epidemic cases. For epidemic cases, just like COVID, we never know what was the totality, what was the symptom picture of COVID. But if you remember at that time, so many people on WhatsApp and other social media, they were telling different sets of symptoms. In different countries, there were different sets of symptoms. So unless and until you make the clear picture of pathology and the clear picture of constitutional symptoms of the patient, you cannot prescribe. So follow this method for epidemic cases, that even though it is epidemic, initial few patients, you have to take the detailed case as if you take in any new disease. Don't consider that it is epidemic. Don't consider that same patients you have seen before. And then only you will come across the remedy. And when a true conceivable picture is formed on the paper in front of you, then you can think about taking the same remedy for other patients. Then there is idea of genus epidemicus. Dr. Hahnemann has also mentioned about classification of mental diseases. And this 21st century, you will find most prevalent diseases are mental diseases. And the first type is even more common, psychosomatic diseases. Because nowadays, our country is a developing country. We are becoming more intellectual. And when people become more intellectual, they suppress their natural urges. They suppress their natural emotions. And suppression of emotions will lead to some bodily pathologies. This is disease traveling from mind to body, psychosomatic type of disease. So this type of disease you will find increasing in number, like inflammatory bowel diseases, ulcerative colitis or Crohn's disease, irritable bowel syndrome, autoimmune diseases because of stress. Even other types of diseases also to be paid attention to, but these psychosomatic diseases are our bread and butter. And I tell you, homeopathy is the best system of medicine which considers the mental condition of the patient, even though patient has physical problem. And psychosomatic diseases are best treated with homeopathy. And that's why homeopathy will become the most successful #1 system of medicine of choice in next few years. Similarly, Dr. Hahnemann has given idea of one-sided diseases. One-sided diseases means diseases which have very few symptoms. We are habituated to take the complete totality and to prescribe. But in some patients, you don't find too many symptoms, only 2 or 3. How to deal with them? It is mentioned under these aphorisms. Again, there is a question of external application. Many people are confused when to use and when not to use. Hahnemann has given clear-cut guideline. It is to be used when there is a dynamic disease. That means surgical cases. You have got injury, you can use local application. But if you have dynamic disease like eczema, you are not supposed to use external application. It will suppress the condition. That will suppress the disease and it will go to inner organs, will affect the more important organ. So once you have clear-cut idea that when to use external application and when not to use, you will at least will not suppress the disease. Then the big question comes about potency selection. There are 3 scales: decimal scale, centesimal scale, and LM potency. Centesimal scale and LM potency are introduced by Hahnemann and decimal scale by Dr. Eric. So some people say only centesimal scale, some people say only LM potency. See, for every case, the choice of potency will be different depending upon the condition of disease. So you will be lucky person if you are enough intelligent to decide which scale is to be used and which potency is to be used. Because what Hahnemann said is your potency, the strength of your medicine should be slightly greater than the disease. So how to understand the strength of disease? It's a $1 million question. But if you have taken case well, you have understood the susceptibility of patient, then this will be not a problem for you. You can use any scale depending upon your choice. But important thing is LM potencies are used in most advanced pathologies where you have got freedom to repeat the doses even on daily basis. But for centesimal scale, the rule is you have to administer only one dose and then you have to wait, observe the reaction, and when the action of first dose will get exhausted, then only you can repeat the second dose. So every scale has its own advantages and of course the limitations. And that will be the wise person who knows both pros and cons of each and every scale. Nowadays, patients have become very smart. They Google the things and then come to you. After you prescribe them, they will ask you, doc, what diet I should take, what regimen I should follow. Dr. Animan had understood all these things also. So he has given importance to diet. Just simply saying balanced diet is not sufficient. We have to understand what are the dietary deficiencies of the patient. And that's why totality of symptom is important. Making the true picture of the disease is important so that we can understand. And along with, we have to do necessary investigations. Nowadays, patients come with a big file of investigation reports. Then there will be no problem. But if there are no investigation, please don't hesitate to do necessary investigations. Don't simply say that we prescribe on totality. We don't need reports like that. Understanding the underlying pathology is very important. Understanding the problem as a whole is important. And if you provide required diet, patient will recover fast. And not only diet is important, of course the regimen. Nowadays, because of social media, the big wrong habit is sleep late and awake late, which is very harmful for our body. Our sleep cycle has disturbed. Our routine has disturbed. And then patient feel lazy throughout the day. So we have to correct it through the regimen. And when you can give proper advice, if you have taken the right totality, if you have understood the problem as a whole at holistic level. So nowadays, diet and regimen advice is equally important as the prescription. So I will recommend that never forget to advise this to your patients, because it is also a kind of accessory mode of treatment. Your medicine, if it is right, the similimum, it will definitely work. It will remove the disease. But the patient has already suffered from it, must have developed some deficiencies, and those deficiencies cannot be fulfilled by similimum. You have to provide proper diet, then only those deficiencies will be fulfilled. Then comes auxiliary mode of treatment. It may be massage, it may be mesmerism, it may be warm bath. Which type of treatment should be taken is the choice of physician after listening to the totality, after understanding the disease. So from case to case, it will be different. You can't give massage to everyone. You can't mesmerize each and every patient. If the patient is thermally hot, you cannot ask them to give warm bath. So depending upon totality, we have to advise auxiliary mode of treatment. So the basic concept of our treatment is to understand the patient as a whole. And then you can go ahead with auxiliary mode of treatment. At the time of Hahnemann, whatever treatment were available, he mentioned in the aphorisms. But nowadays, as we are advanced by 200 years, in an Indian scenario, yoga and pranayam, meditation, these are popular mode of treatment which cannot replace the simillimum. Simillimum is required. But this can help us to rejuvenate our body, to cure it fast, and develop the equilibrium again. Whatever is disturbed because of disease. Music therapy is again a big topic to be discussed. But in short, I can say music which will soothe our mind, will relax our body, is always good for us. Again, we have to go in details of it, what kind of music is suitable for what kind of disease or what kind of mindset the patient is having. And I tell you, Dr. Shankaran sir has done proving of some ragas. You know, in music there are ragas. And this type of things will help our patient to achieve complete cure. So I would like to take the opportunity to say thank you all for listening this lecture, and thank you again for all the authorities of RVS Medical College. And definitely I am indebted to our Shekhar sir, who has given me opportunity to start with my lecture, first lecture of this 12 lecture series, and my all colleagues of SWARA Homeo Gurukul, where I learned all this skill, and whatever you got today, that is the teaching of our Shekhar sir. Thank you so much.